When I was asked to chair the event and I was looking at the programme, what I could see was the significance and the opportunity to talk about the London Health Commission and to move from a very, very interesting report to the importance of making it happen. We've also had Simon Stevens' NHS England 5-year forward view, which has got some profound I think ideas and consequences which many people have said are to be welcomed, but again presents that significant issue of making it happen. In the programme this afternoon we also have a very, very strong feature which I think has been current in all public services, not just in the health service post Mid-Staffordshire, but also many of the incidents post Winterbourne View, post issues around children in care, around connecting to people who use our services, the communities in which we operate, in very, very different ways in the future. And when I was thinking about that agenda, it chimed with some work that I was fortunate to do with the World Economic Forum. And the significance of this is that the sponsors for the work were the credit ratings agencies who look at international expenditure across countries, and they identify the risks to being able to have viable economies. And when you look 3 to 30 years out, rather than the 1 to 3 year balancing I&E, and they were looking at where the pressures on public expenditure were, it is absolutely in our court. It's health, its benefits, its welfare, and the piece of work that they came up with what are the things that governments, systems should be doing to address those issues such that the GDP proportion is manageable in future to create a sustainable economy. And interestingly, they said 3 things. The first is that we have to understand the ability we now have to change people's relationship with their own health. So all the technology, all the information, the way in which people are now assets, not seen as need, all of that is fundamental to the future of being able to deliver better outcomes and manage costs. The second was that if that is the case, how do you then reorientate your healthcare delivery systems, your social care delivery systems, to ones which effectively can intervene earlier, can be more preventative in nature, can support people themselves in terms of managing their own problems. And the third was that you effectively stop spending money with a sense of function, i.e. our silos, right from the top, from government down, and you start spending money with a sense of place, where you can make sense of it in the context of local places in order to get best value. And so when I think about that, and I can link it to the agenda we've got this afternoon, you couldn't be more on the money in terms of thinking about London, the London Health Commission, all about a sense of place, the sense of we need to change our delivery systems and thinking about how you take forward the 5-year forward view. And we certainly need to think about being able to connect to people in terms of their own health, which of course the London Health Commission has championed so strongly. Of course, the missing ingredient, which is where I come to the people in the audience, is that none of that actually happens just because you say it in a wonderful report, or whether it's World Economic Forum, the London Health Commission, NHS England's piece. It's all down to what people choose to do and to how they work in systems rather than single institutions to effectively deliver that. So I think in terms of setting the scene for why this is so important, I think it's very much down to the response of people this afternoon and what people take away and then go and operationalise locally. So high stakes, that's what I'm saying.